Hello, my name is Chris, and in this video I'm going to teach you how to do Exillis skin tightening on the face and neck for your patient. When selecting your settings for your facial treatment, you're going to select the small handpiece, which is R2. Then you're going to select Therapy. When selecting this, it's going to ask you what area you're treating on the face. So today we're going to select the neck. The power, you always again want the power to be on the highest setting. So it's always going to be at 90 for the highest, then you want to hit enter. The duty factor on this one, you always want to be at 100% for the highest depth of range. Hit enter as well. The time frame that you're going to do, I normally split the neck in 2 treatments. So you're going to do on the left side first and then continue on the right side. Normally I like to do 10 minutes on each side. So set it for 10 minutes and then hit enter as well. When you go to connect the grounding pad, it connects in the side of the small handpiece just to the right of the handpiece. On this one, it does not have the temperature built in the top. However, you do have the settings here to control if you turn down the heat or not. Once you're ready to start your treatment and you connect your grounding pad treatment to it, you're going to go ahead and hit start. Now we're going to show you how to do the patient's neck. So the first step is you're going to apply ultrasound gel to the area that's being treated. Typically, I always use cold gel for this because the treatment itself gets warm. That way, if the patient gets too hot, you can always kind of take down the temperature just a bit by using the cold gel. However, you want the temperature to get at the proper settings it needs to be to give them a good treatment. So again, I always split the neck in half, but always leave this middle section to be treated by both durations of your treatment. Once you've applied your gel, your treatment's already grounded to the connection, and you're going to go ahead and start your process. Your button for this is on this side, as well as the metal tip is on the beginning. Always make sure that this stays in contact with your patient during the treatment, or you could burn them. So when you're starting, place the tip on the skin and click your button and start moving. You want to keep this moving, not leaving it in the same spot, because you can risk burning the skin as well, besides the fact of breaking connection with your patient. You can do different motions, whether it be going up and down or across. I tend to do both. You can also do figure eights. It just depends on what you're comfortable with, but make sure that you give your patient a good treatment. Now the smaller one gets hotter faster than the larger one, so you do want to move it faster, not slower. Just because you're working with smaller areas. So you can see the skin is already getting pink. This also stops every 30 seconds. So as it stops, you're going to have to click that button again to keep it going. The reason being is so that you have time to spread your gel again if you need to. Once you get your complete time frame on this side done, then you'll continue on the next side. That way the patient has a complete treatment. Always make sure you have your before photos done so that at the end of their series they can see the difference in their treatments. Now that we've done both sides of her neck, I'm going to complete her treatment by applying some green tea serum and some zinc sunscreen. You always want to make sure that you apply aftercare on the areas of treatment that can be exposed to the sun. So once you've applied that, you want to make sure that you tell patients commonly in the neck area when you treat it that they can be tender when they turn their neck just because you've applied a lot of heat in the area, as well as to wear sunscreen and drink a lot of water. That is it for our Exillis treatment for the neck. If you have any questions, please let us know. Thank you for watching.